Hello, hello. Happy Friday, friends. Thank you for joining me. Hello on all the platforms. If you are watching or listening, just place a hello in the comments. I always love to see who has joined me. And even if you watch this later, if you're watching a replay, put replay in the comments and still leave any questions or comments after the fact that you may have, because I always check the comments and I'm happy to go back through those comments and share more information with you. This is what I do. This is what I enjoy doing. So feel free to do that. All right. So welcome. Hello, friends. Welcome to my Friday Facts Live series. For those who haven't watched before, I am Dr. Shayla Toombs-Withers. I'm a plant-based physician and I'm the owner of Essence of Health Wellness Clinic and Coaching. Now, in this month of April, the United States Health and Human Services Health Department, they highlight National Minority Health Month. And then in this particular week, we highlight Black Maternal Health Week. So I'm glad that you're here for today's Friday Facts. As a healthcare professional, we recognize that racial and ethnic minority populations in the United States suffer at higher rates from health conditions that can sometimes be prevented with the proper awareness, adequate healthcare access, and understanding of our cultural differences. This month highlights how improving health communication for all of us can actually help us advance health equity for both racial and ethnic minorities. Now, every week this month, I will be coming to you live with relevant health topics for improving the health of minority populations. You can watch last week's Friday Facts video for breast cancer highlights in women of color. And you can watch this past Tuesday's live video where I came to you live with Dr. Amanda Atkins to share some helpful tips regarding diabetes. And then stay tuned right here on Tuesday, April 25th, as I'll be discussing additional health topics related to diabetes and people of color with fellow lifestyle medicine colleague, Dr. Amanda Atkins. Now, let's discuss today's Friday Facts on Black Maternal Health. Black Maternal Health Week is observed April 11th through 17th during Minority Health Month. And this week was started in 2018 by the Black Mamas Matter Alliance to raise awareness and help improve Black maternal health outcomes. Through a series of digital events and community engagement, Black Maternal Health Week uplifts Black women led organizations to focus on the root causes of poor maternal health outcomes while engaging Black voices to lead immediate conversations around community driven policies and programs. Here's why this is so important. We know that racial disparities in healthcare exist. The Centers for Disease Control and Prevention, or the CDC, reports that Black women are 3 times more likely to die from a pregnancy related cause than white women. We know that multiple factors contribute to these disparities, such as variations in quality health care, underlying chronic health conditions, structural racism, as well as implicit bias within the healthcare system. Now, here are some additional fast facts from the Centers for Disease Control. In 2020, 861 women were identified as having died of maternal causes in the United States. Of this, rates for non Hispanic Black women were significantly higher than rates for non Hispanic white and Hispanic women, showing that Black women were 3 times more likely to die from a pregnancy related cause when compared to Hispanic and white women. And here's the most sobering statistic: over 80% of pregnancy related deaths were determined to be preventable. So, here are some things that you should know. And I want you to listen closely if you are currently pregnant, if you are planning to conceive, if you have a friend or family member who is pregnant, or if you are the spouse or the partner of someone who is pregnant. Be aware of these urgent maternal warning signs and symptoms both during pregnancy and in the 12 months after the delivery of your baby, because this is still a very critical point of time in your health. So, signs and symptoms that you want to look out for will include headaches that won't go away or seem to get worse over time, dizziness or fainting spells, changes in your vision like blurred vision or double vision or seeing spots. Those things are not normal. Fever. And I want to pause here to say fever because oftentimes I hear people say, I have a fever and oh, my temp is 99. So, a true fever is considered a temperature of 100.4 or higher. So, if you have a fever, that is cause for concern. Extreme swelling of your hands or your face. If you have any thoughts about harming yourself or your baby, that's a point of concern because we do know that postpartum depression and postpartum psychoses, these are real things that can occur. If you have trouble breathing, you definitely want to take notice. If you're having chest pain or you feel like your heart's beating fast, like palpitations, you can feel your heart racing. If you have severe nausea and vomiting, we all know that some people have morning sickness, and morning sickness doesn't always occur in the morning. But if it's severe to where you're not even keeping down fluids, then that is certainly a cause for concern. If you're having severe belly pain that just won't go away, if your baby's movement has stopped or slowed down or not typical during your pregnancy, like what you usually feel, if you're having vaginal bleeding or you're noticing fluid leaking during your pregnancy, or if you're having vaginal bleeding or some type of vaginal discharge, especially if it has a different kind of odor or a different kind of color that something you haven't seen before after your pregnancy, those are reasons for concern. If you have severe swelling, redness, or pain in your legs or in your arm, those are definitely concerns. Or if you just feel overwhelmingly tired. We do know that pregnancy, as well as delivery of a baby, will come with some fatigue because it's a challenge, but you should be able to get up and function. So if you're feeling overwhelmingly tired, that's definitely a reason to pause and a reason for concern. And if you have any of these symptoms at all, then you want to seek medical care from your doctor or at your local emergency room immediately, as recognizing these symptoms could actually save you and your baby's life. Oftentimes, we try to talk ourselves out of what we are actually experiencing. So don't feel like any question or concern is too small, and don't minimize what you may be feeling. And we do know that one of the contributing factors to Black maternal mortality is simply that Black women aren't always listened to. So, if you feel like your doctor is simply not listening or taking you seriously, then seek medical attention elsewhere. You do have the right to quality care. And one last thing to be mindful of is that it is very important to optimize your health before you are pregnant or before you are trying to conceive, as this is actually one of the best ways to reduce your risk for complications during pregnancy and during delivery. As a physician health coach, I teach women how to nourish their bodies healthfully, move their bodies, and develop healthy mental health strategies to achieve sustainable health and wellness in order to prevent and reverse many common chronic health conditions like high blood pressure, prediabetes, diabetes, and high cholesterol. If you are having challenges with any of these health conditions, I'd like to personally invite you to join me at my upcoming live masterclass event, What Your Doctor Didn't Tell You About Reversing the Health Crisis Trifecta. This event will be held virtually live on Sunday, April 30th at 6 o'clock Eastern Standard Time. So join me at this event to discover the key components needed in your daily routine to reverse the health crisis trifecta of high blood pressure, prediabetes, diabetes, and high cholesterol. Join me to learn what key nutrients you should definitely add to your plate and why fad diets don't work. And join me to learn the fastest path to achieving success in reaching your health goals and reversing the health crisis trifecta without taking more medications. Now, registration is required for this event, and I'll place the registration link in the comment section of this video. Thanks for joining me today on the Friday Facts. For more health tips, grab your free copy of my ebook at essenceofhealth.link/e-book. I also invite you to learn more about me, learn more about the Essence of Health Signature Coaching Program, and Essence of Health Wellness Clinic and Coaching at eohcoaching.com. You can tune in every Tuesday to my podcast, the Essence of Health Tea Time Podcast, on your favorite podcast app for all things health, wellness, and plant-based nutrition. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, Dr.TW at EOHWC on TikTok, and Shayla TW on LinkedIn. I look forward to working with you, and I offer a free strategy session so that we can chat one-on-one about how to help you achieve your health goals this year. Have a great weekend. See you next week live. The essence of health is in you.